would you just like to introduce yourself and tell us where you're from?
Yes, okay, I'll walk right. My name's Kambourakis. I work for SANE Australia, which is a national charity, a mental health charity.
Thank you. And introduce yourself?
I'll do it this way because
I'm keep going.
It just works better.
Yeah.
I'm Nicole Staats, and I'm the New South Wales Health Promotion Officer at Neami, it's an NGO in the mental health sector.
Now, Neami is a tremendously interesting acronym. It used to stand for something, Northeastern Alliance, I think, for people with mental illness, and you're considering changing to a new name. Do you want to explain?
I might have let a cat out of the bag to you earlier, but yeah, it used to stand for the Northeastern Alliance of Mentally Ill, based in Victoria, northeastern suburbs of Melbourne.
Yes.
But it's kind of, when people identify with it, they kind of more identify with a fish. So I think it might be
because Neami, Nemo.
So I think they're throwing around a name change, and yeah, but what that's going to be, I can't say yet. Yeah.
It's just an interesting dilemma when people have a title that once had things like mental illness in it.
Yeah.
Now you don't want to say mental illness, but you're known as Neami.
Yeah.
And I know it sounds like a small thing, but of course Neami means nothing to people.
Yeah.
And so for outsiders it can make us even more impenetrable when we hold on to acronyms. And I think in terms of extending the knowledge of our work, these naming issues actually do matter quite deeply. Now, are you two working together on a project?
We're working in partnership, so maybe I'll start say a little bit about how the health promotion project at Neami started, and then we found SANE, and they've kind of been backing up what we've been doing.
Yes.
So basically, what have you been doing?
Well, first, I don't want to harp on about smoking because I know there's so much more physical health that we could be talking about, but that's kind of what the catalyst was to our health promotion project. One of the policy and projects officers got asked to look at the smoking policy, and from looking at all the research and the rates of smoking, she was like, we need more of a response than a change in policy. So from that we've had an organisational commitment and investment, and we've really unravelled some of the physical issues. So we've been looking at oral health, diabetes, smoking, connecting consumers to better GP care, and healthy behaviours is something that we're going to get into next. And that's been reframed from lifestyle modification based on some of the comments we've heard earlier. So I guess there are a couple of slides which can kind of pinpoint some of the areas that we have addressed.
Do they have pictures or words?
Just some words.
No, I'm not worried about the words. You tell us. You've got them out. Yeah.
But then I guess for organisations to come away, what are some of the key areas that we can look at? So making sure you've got upper management and organisational commitment, reviewing policies and structures and processes across the whole organisation, so from risk assessments, intake forms, as well as what your policies say. Professional development, education and training of staff is a huge one. Whatever's out there, smoking, I think we've had 40 to 50 staff trained in New South Wales now.
So if people could please turn off their devices, from now on I'll confiscate them and give them to child protection workers in remote Australia. Well, the other suggestion is I should answer them and have a word with the people, but if you could turn it off. What are the results you're aiming to achieve? What's all the action leading to?
Well, I'll use the smoking project just because that's the one we're most progressed in. 2 years ago, we still had a lot of staff smoking with consumers, still using it as rapport building, still seeing it as an acceptable part of practice. Slowly, with policy change and training, we no longer have any staff smoking with consumers, or if they do, they'll be performance managed. We've had staff trained and professionally developing and supporting consumers with smoking cessation.
I'll just pause you there because see how there was that nervous language titter. In all seriousness, how do you interpret that when an audience responds like that? What is that? What message are you receiving?
Was that about the staff and not smoking, or
the idea that there would be
well, I guess.
You've been told off,
Sorry?
Look, that was a hard question. Let me put it a different way. Why do you believe it is justified within the sort of service you're running to have performance management associated with failing to obey an instruction not to smoke with clients? Why is that an okay thing for managers to do?
Well, I think it's the organisation taking it seriously. That if you're not role modelling, not only role modelling but not supporting this behaviour, which is detrimental to consumers' health and well-being, then what are you here for? Are you here for the consumers' lives? Are you here for their values and to work with them, or are you here for yourself? And so I think like saying you jump straight to performance manager, probably warnings and conversations, but it's a serious breach of policy in our organisation now if you're not taking physical health seriously.
So has that inevitably led to helping staff who wish to address their smoking? Is there, you can do it, we can help you, messages going to staff as well as clients?
Well, that's been one of the other steps in the smoking program. Is now we have, across 11 sites, we had 5 smoking cessation support groups, which staff were also invited to participate in if they want. And I think we had 3 staff engaged in smoking cessation and quit through that process as well. So there hasn't been the financial support within NRT, but definitely about providing space and time and support as much as possible. Because we do believe in the parallel process with staff and consumers as well.
Why? Why a parallel process?
Well, I think, you know, we spoke about this in the earlier panel, if you are not role modeling, if you don't believe in it, then how can you support your consumers? There's a challenge there. So promoting health for staff and consumers. Yeah.
And this is just one of a number of initiatives, isn't it? I know I've focused in on the smoking. Perhaps just quickly, and then I'll come to you.
Yeah.
You mentioned also assistance to get people connected to good general practitioners. Tell us a little bit about that.
Well, this has probably been one of the most challenging projects, but I'll probably talk about a pilot project that we did in Victoria with that. And so we used a screening tool called the SCOT tool, which was more of a referral point to identify the needs and issues with each consumer. The key part to that project was that we're working in partnership with the community health centres in Victoria. The health system, like I think has been commented, is a bit advanced or quite different in New South Wales, that it's easy to connect people into the one-stop shops. But we've been kind of discussing, was it the tool or the partnerships that helped those consumers to start addressing the GP care and getting the early detection and regular physical health checks. So we think the key was the partnerships. So that's something we're starting to do in New South Wales, is liaising with GP divisions, trying to build at a service level and consumer level better relationships with GPs and medical centres. Even on a basic advocacy level, if a consumer's got anxiety, doesn't want to spend 2 hours in a waiting room to see their GP, how can we negotiate that when the consumer comes in they can get straight in? All that kind of simple, practical stuff.
Can you give her a round of applause, please? So, can you tell us about the Mind+Body project that you're doing with SANE Australia and how it links?
Yeah, well, I actually told Nicole not to encroach on my territory. And she did.
But that was under my project.
Yeah. So the Mind+Body project is a project that focuses obviously on physical health of people living with mental illness. And we look at ways of improving the capacity of the mental health sector, in particular the non-government organisations, in helping them to build capacity to improve the physical health of their clients. And we also look at how to improve the capacity of related sectors to help their understanding of people living with mental illness.
Can I just come in there? I know building capacity is like a piece of our jargon, isn't it, in a way? What does building capacity mean when you're saying you're working with organisations to build capacity?
It means basically everything that I have in these guidelines, which are hot off the press and in draft mode still, because we want people to give feedback. But it basically means helping them to realise, first and foremost, particularly with mental health organisations, to realise that it is part of their role in working with the consumer and building autonomy for their recovery. It is part of their role to support their physical health as well as their mental health, because the two are so interlinked. So that would be the first step. Then it's about helping those organisations to build framework around which they can then see positive and real changes in clients on an ongoing basis. So not things that are just ad hoc, staff that are particularly interested will do, but not everybody. Helping them to build a framework to enable those actions to occur and to keep occurring over the long term.
What is SANE Australia, just for those who are new to this world?
SANE Australia is a mental health charity, a non-government private mental health charity. We produce a number of resources and educational material, some of which I've actually got out on a display table, so I suggest you all go have a look. There's Mind+Body resources, resources around smoking. We also produce, we have run a helpline, a national free call helpline, that anyone can call in and get information about mental illness and also referral to services. We have we have a workplace employment program, so a number of different things, a bereavement program, the Mind+Body project.
I have to manage the time, so I just have to ask you one last thing, but I'd encourage you to go to the table, although Janet's asked me to remind people if something's got display only on it, if you could leave it there. And so I think a few people have taken display only things, if you could pop them back. But, you know, this focus on physical health, it feels like it's gaining more and more general awareness within the community. Are you hopeful of change?
Absolutely. I mean, more and more organisations, non-government organisations, are picking up on the fact that they have to do something. Traditionally, that part of health was not considered by the mental health sector. It's obviously being talked about more and more now, but it's a matter of I guess, assisting organisations to help build that framework so that they're able to actually deliver that message to the consumers and to the staff.
Okay. Thank you so much to both of you. Thank you. Would you give them a warm round of applause?